Every time I look up, there's an announcement, Children's is doing this and Children's is doing that and Pediatrics and Georgia Tech. So there's been a lot going on. So I'm hoping you can just update us and then help our community kind of know how to respond to and be ready for these opportunities.
Yes, so that's exactly what I'm going to do. Let me see if I can screen share. And maybe, there we go. So for any of you who may not know me, I'm Leanne West, and I'm Chief Engineer of Pediatric Technology at Georgia Tech, and I'm also president of something called the International Children's Advisory Network. Um, and what I'm going to talk about today is some of the relationships we have with different hospitals, different projects we have going on with them, and then at the end I'm going to kind of give you a slide that says all the different ways that you could interact with children's hospitals that we work with. So some of our children's partners, our Children's Healthcare of Atlanta, I guess that's probably obvious, them being in the same town. That relationship started kind of officially about 10 years ago, but many projects were going on before that. Shriners Hospital is a fairly new relationship, but they, to date, have funded about $1.3 million in projects, and so we're super excited about that, and we expect that to keep growing. Children's National in DC. So we've had a relationship with them for a while, but we haven't been able to get projects off the ground. But recently, their emergency department reached out, and so we're going to start some projects with them. And then also Children's Hospital of Orange County. So while we don't have any projects with them right now, they're a really strong ally of ours, and we hope to be able to do some things together. All right.
Leanne, I know
Yeah.
that we submitted something. I don't mean to cut you off on your presentation. It's so good, but we are with family here. I know that Pinar and our friend Louie
Yep.
at Chalk submitted something, but I don't know. Have you heard where that is?
I have not.
I'm going to text Birgit right now while you're on the phone, see if we can.
There you go. Do that.
I will.
Absolutely. Okay. So this is just kind of a generic slide, but really what it's meant to say is we work in all areas across campus. So a lot of what my job is day to day is I will talk to clinicians and understand what their needs are in the clinic to be able to take better care of their kids. And then I will introduce them to teams at Georgia Tech that have technologies that they're working on that I either think are directly applicable or maybe could be modified or maybe it's something totally new. But we do work truly any group across campus. We've done policy, we've done business, we've done 3D printing and sensors and mobile health and drug delivery and all sorts of things, vaccinations. So don't think that what you do is, maybe it's not really right for a pediatric project because I'm sure we can always think of something. Here we go. So here are some of the opportunities that I want you to know about, and feel free to either one, stop me and ask questions, or two, send me an email and I can send you more information. But with Shriners, we just closed a seed grant call. We will be announcing those winners in about 2 weeks, last week of October. And that went really well. That was about data and data analytics. And so Shriners, with us as a partner, would love to see all of their healthcare data made available to Georgia Tech researchers so that we can do data analytics on it. A lot of their data analytics is on motion analysis. They have a lot of kids with extremity issues. Maybe they need an exoskeleton, maybe they walk with a walker or some other device. So that's one area. And then also imaging. So like a lot of these kids have to have x-rays and CT scans and all these things to see kind of how their disease is either progressing or maybe how rehabilitation is making things better. So there's a lot of really good data there that hasn't really been used yet to do a lot of the predictive analytics and monitoring that I think we would like to do and that they would like to do. So we see that as a growing relationship. We've also done quick wins with them, which is something where you may have a technology. Somebody might come to me and say, we want something to do X. And I would go out and find the team who could do X. And so right now we've funded 4 quick wins, 3 of which are in the robotic exoskeleton space. and one of them is a data analytics one. And so we're excited about those. Class projects, so there's a lot of faculty members that I collect projects for, and you'll see this repeatedly, who maybe want real-world problems to use in their classroom, whether it's in a regular class, maybe it's a capstone program, maybe it's the VIP classes. So I can gather real-world problems for you if you'd like them to have them for your students. Children's Healthcare of Atlanta. So we do so many things with them. We've done seed grants in the past and quick wins programs with them. Right now, we're doing Inlay Funding program with them. The Inlay Foundation gave Children's Healthcare of Atlanta an endowment to pay for doing research with Georgia Tech in the pediatric healthcare space. And so that's been really, really productive so far. A lot of really good things have come out of that. And I'll talk about some of these in a minute. Again, Capstone Projects, I'm always collecting capstones for BME, particularly from them. Children's National, again, we're starting to work with the emergency department there, and they're super excited to work with Georgia Tech. So I know that we are working on a relationship for capstone out of ISYE, particularly. We also have, they have something called the Pediatric Device Consortium, which is where if you have a pediatric device that you've built and you'd like to see it go to market, if you needed more funding to help you get it a little bit farther along down the path, the Pediatric Device Consortium is something that you could apply to get $50,000. Those pediatric device consortiums are funded by the FDA through a grant by the FDA, and there's 5 of them around the country. So there's different times a year that you can propose to different ones, and if that was of interest to you, I could certainly help guide you in that space. They're also willing to pay for travel for faculty and students once people can travel again to come up and look around, meet the clinicians, look around the emergency department, that type of thing. So I think that that's a unique opportunity as well. Again, the VIP program, the technology, Pediatric Technology Center, so that's where I sit. We have a brand new endowment that is coming this year. Well, we'll be funding something next year. Finally, we got the money this year. And we're looking to see how we're going to spend it. I'm thinking we're going to have seed grants for sure, but I'm not 100% positive on that. I do know we're going to do Petite Scholars. I would love if any of y'all are interested in the Petite Scholar program. I'll tell you about that for a second. So Petite Scholars is a program run out of IBB, the Institute for Bioengineering and Bioscience. And historically, it has been related to bioengineering and bioscience, but with the pediatric projects that we have brought to them, they were able to do any domain across campus. So any faculty member is welcome to put in a project there, and if you have a student that you like working with, you can encourage them to apply. It is for undergraduate students. It is a competitive program. You apply over the summer around July, August, I think. And then what it does is it funds a student to work with a faculty member for a calendar year, so January 1 to December 31. So it's a really unique program. I think it's a really interesting opportunity for students. Again, historically, groups outside of IBB have not been able to partake in this program, but with the Petite Scholar we're going to fund from PTC, it can be anyone across campus. Tech Talks is a series that we have going on. We do them about once every 3 months. We might do them more sooner rather than later. What we do is we interview somebody from Georgia Tech to tell us about their technology. So it's kind of just me and them sitting and chatting. It's streamed live. You can ask questions. And then we also make them available on our website afterwards if you wanted to see one after the fact. And so that's interesting too. So we've tried to get some interesting people there. I think up next might even be next week. I should probably know that. I'll send it to Faith and or Beth. I think it is next week, Wednesday at noon. We're going to be interviewing Jackson Medical, which started out as a project at Georgia Tech and in the BME Capstone program and has gone all the way to being a company. And so I think that that's a really interesting one to see how that clinical need really drove the innovation there. So that's really important, what I just said, clinician-driven problems. So at the Pediatric Technology Center, we work a little bit differently than a lot of the research you might really think about going on campus. And so we start with a real-world problem that somebody comes to us with, and then we find the right people who have technologies and research that make sense to work on that problem and solving that problem, as opposed to, I've built this really cool thing, now where can I use it? And so that's really important. So again, everything we do is real world, solving a real world problem. So this is an example. You can barely see the baby in this room. The child is hooked up to a machine called Ecmo, and you can see the yellow circle goes around the display that gives you things like heart rate and respiration rate and heartbeat, all those different things, the vital signs that the child is being taken. And you can see that it's kind of like buried in this mess of displays and things. So we have somebody on campus who has built we're calling it the bio patch. You can see it on the left-hand side. You can see that it's built into like an adhesive dressing that you could put on the body so it tapes onto the child. And it takes a lot of information like EKG, respiration, motion, temperature, and breathing. And it sends all that information, instead of just to the screen where you saw it kind of buried before, it can send it to the cell phone. And what they have started doing with this data, which is really more important, is being able to look at ICU data that's being generated in real time. So as that child is hooked up to all those machines, they're taking that bedside data and determining whether or not that child is ready to move out of the ICU. So I think that that's a really remarkable one, and I think that that's, kind of just the tip of the iceberg when it comes to precision medicine and really using data to kind of predict what's going to happen and make sure that we do things correctly. Here's another one. You may have heard about this one, but it's called an IV infiltration detection. So when you put an IV into a vein, you could get it in and everything works smoothly and the liquid goes into the vein like it's supposed to. But you may miss the vein altogether. You may break through the vein, or the vein may burst. And in those situations, the two pictures that you can see that are horrible is what results from that happening. So a lot of these drugs are actually very caustic, and what they can do is eat away at the skin and the tendons and the nerves and the muscles, all those types of things. And so you can imagine on an infant like this, they're going to have permanent damage from that for the rest of their life that they're going to have to deal with. And the hospitals spend millions of dollars every year trying to correct some of these things that happen. And so in talking to the nurses, they're like, if you could detect this in under 30 minutes, that would be huge, because right now they rely on the nurses to be able to go around and check each individual IV every 30 minutes. And sometimes when things get busy, it doesn't happen. And then also when somebody is being operated on, the body is usually all covered except for the area that they're operating on. And so you can't see that it's happening in that situation either. So what we did, think back to the last thing, the nice little bio patch that I showed you. Well, this is a very clunky version of something similar, but what this is going to do is it's going to be built into the dressing, just like the bio patch looked like. Eventually, it goes around an IV site, and it has detection sensors in it to let us know if the IV has infiltrated. And so we're super excited. We've done it with pigs and things like that, and some other tests with inanimate things, meats. But we have just started doing this at Children's Healthcare of Atlanta, so we're looking to get real-world data to let us know that what we think we can do, we actually can do, and instead of 30 minutes, we think we're going to be able to do it in about 2. So we're super excited about that, as is Children's. This is kind of a cool project too, a little bit different. So looking at the sound that a joint makes. And you might think that's kind of weird, but we've all heard our knees or wrists or whatever pop sometimes, make weird sounds. And so one of our researchers on campus decided to listen to these sounds and see what he could determine from it. And what he has been able to show so far is he can put a sensor on the knee, and when you move the knee, it will make a noise. And you can see here that a healthy knee sounds one way in the purple and blue, And a bad knee sounds the other way and a little bit differently in the red. And so they're very distinct. And so this is being used to look at things like sports readiness. Maybe you've had an injury playing sports and you want to, the doctor wants to know if it's okay to let you go back to playing sports. They could implement something like this that gives them a whole lot more information than they get right now, but, where they really are just bending your knee and like kind of half listening to it, trying to feel it and things like this. This is much more specific. And so we're really excited about that one, as is children's. Tracheal splint, this is one you probably really have heard of. If you haven't, you can Google it, and there's videos out there. So we have a researcher who was talking to a doctor, and the doctor was like, hey, we've got this problem where children are born with a trachea that's collapsed, and what I want to do is 3D print a trachea. And the researcher was like, I don't know if we want to 3D print a whole trachea and have it grow with the patient, because we're talking about infants, newborns. So what he said, though, was, look, we can do a splint on the trachea, and that way it can hold the collapsed part open, and that way the child can breathe. And then as the child grows, it eventually grows without that collapsed part because of the splint. And then the splint itself is made of a biomaterial that gets reabsorbed into the child after 3 years. And so there's never a need to go back in and replace anything or take anything out. And so this is an example of one of the babies that we did this surgery with. So this doesn't happen often. This child was the 6th in the world to receive this surgery. And these kids who have this condition, they can't live on their own because they can't breathe. And what's so great about this, and the piece that I love, is in the bottom right corner, you can see the mom holding the baby. And that was the first time that the mother had ever been able to hold her child. The child was 4 months old. So if anyone has children, you can imagine just how, gut-wrenching that would be, never being able to hold your child. And so that first time was just really amazing. Here's a very cool project. And this one was actually funded by the Pediatric Device Consortium that I mentioned with Children's National, the one that's funded by the FDA. So this is a material. The problem is something called central line infections, and you can see where the big red arrow is and the blue hand putting two pieces together. That is a connector on a central line. And what happens is you can kind of see where the piece that's in the upper left corner has a piece that's sticking out and like a little shield around that, but there's a depth kind of around that central piece that's sticking out that the purpley piece sticks into. And the way they currently clean those is like a moist towelette. So like think of yourself going to some, shrimp eating restaurant and they give you those little packages of towelettes that you can wipe your hands with afterwards. Well, that's what they did this with. And central line infections are horrible. That's the other number one thing that hospitals want to fix because it can lead to death and it happens all the time. And so you can see here with the Petri dishes, I love this. I had to have a procedure recently and I was wishing I had brought one of these with me. The control group, totally gross, right? We put bacteria on there, grows like crazy. The group that had been cleaned with the moist towelette, you can see also still has lots and lots of gook growing. And then you can see the one with the new tool that our researcher built. It really clears up everything. So what he did, which is a little bit different, is he used a special material. It's actually the same material as in Mr. Clean scrubbing, the little white scrub pads. And they cut it into essentially a sugar cube shape. They soak it in alcohol, and so all that alcohol is able to kind of coat the entire thing and get into all the little crevices, and so it's infinitely better than what they have now. So we're really excited to see that one truly hit the real-world market, hopefully sooner rather than later. This is another thing being funded by Children's Healthcare of Atlanta through their Inlay Funding. So during brain surgery, right now, they will drill a hole in your head, and you can see that on the fake skull at the top. And what they have right now to go in and remove a tumor that's buried within the brain is you have to go in with something, think about it looking like a straw or like a pen. And so it's straight, it's long, it's rigid. And to be able to remove the tumor, that straw has to kind of move around. So it creates this cone of collateral damage in the brain aside from what's already being harmed by the tumor itself. And so we have a faculty member on campus. He works in robotics, and so he has this nano robot that he has created. And instead of it being rigid and causing all that collateral damage, it goes in straight and only the tip moves. And so the tip can go in there and empty out the tumor without causing all of that collateral damage. And so you can imagine what this will really do for brain surgery when he can bring that forward. This is a cool one. This is being funded by Shriners Hospitals. And so they have a lot of kids with these physical impairments that impair their mobility, like I said before. So this is a hand exoskeleton. They have created a process to take a mold of the hand and create a custom glove just for you that has tendons in it. And when you say grip, the fingers will all be pulled together so you can hold on to a pen and write. And so I don't have a slide of the pictures here, but a video, but it's pretty amazing because now these kids who really couldn't hold on to a pen before to write now can with this exoskeleton. And so we're really looking at all of the activities of daily living, what this might be able to help with as we move forward. Oh, I do have video. Well, it doesn't have sound. So the person said close hand. I don't know if you could hear that, but essentially it brings the fingers together when he tells it to do something. And then open hand and it will open back up and it will release. This is another one we're doing with Shriners Hospitals. And so this is a lower extremity exoskeleton. So on the legs of a child, that child in the picture happens to be my child. And he was helping test the system before they actually went to kids with physical disabilities. And what this is doing, and I think this is really interesting, so it's not just an exoskeleton to help the child keep the legs and the knees in a position that makes it able for them to walk, but there's actually sensors in the foot underneath the shoe or as a part of the shoe. And when the child steps, the response of the foot, it can figure out when to give that foot a little extra boost if they're like walking up a ramp or walking upstairs. It can sense how that step is and what that step needs to do to help that child move better. So I think that that's something that will be really interesting too as we move forward. One of the things they're doing right now is trying to get it as lightweight as possible for their young wearers of the system. This is something a little bit different, so it's not a device, but we do have CMS data, Center for Medicaid and Medicare Services data, for all 50 states for several years now. They always run about 2 years behind, so it's never the latest data. I think right now the latest you have access to is maybe 17 or 18, 2017, 2018. But this was a project for Children's Healthcare of Atlanta, and the idea was looking at health outcomes for kids. And the one on the left, I'm pretty sure, was for asthma outcomes. And so if you have asthma, you are more likely to have, I don't know why that just moved. You're more likely to have issues using the emergency department and have worse outcomes with asthma if you're 20 miles or more away from a lung specialist. And so the idea here was to look and see what where children's might want to set up some healthcare centers around the state. So it was really helping them identify what would be the most effective place to put something. This is also really cool, and this was actually done, the Petite Scholars program that I mentioned before, where undergraduate can apply to a competitive program and then work with a faculty member for the course of the year. So this is one of those that came out of it. And one of our very smart students who has anemia, where he has to check his anemia levels all the time, figured out that instead of pricking your finger all the time and doing these tests, that he could take a picture of his nail bed and he could tell what your anemia level is just by taking a picture of the nail bed. And because there's no melanin in the nail bed, people of all skin colors, this will work for. So they've tested it on all skin types. And so that's really amazing. So you can imagine, especially with kids, if you can get them early, if you're not constantly poking needles at them and things, you're going to be a much better experience for the individual who has to deal with this. much less pain and much less kind of built-in fear of going to doctors and things like that. Another app that has been built is one called Your App, and this was also a Children's Healthcare of Atlanta. And the idea was that for kids with nephrotic syndrome, so it's a liver issue, it's very hard to get these kids to test their urine to see if there are proteins in it, and if they do, having them remember what it is when they came in after 3 months, and doing this every day is when they'd really like you to do it, maybe even multiple times a day. And so what we built was an app that if you use the test strip, instead of you trying to read it, you just put the app on it, and it'll tell you what the reading is on the test strip, and it works with, I think, the top 3 test strips that are commercially available. And then it stores all this data. So not only do you have correct data and you don't have people guessing as to what the answer is, but you also are having it recorded so that you can take it into your doctor or send it to your doctor so that they can see how you're doing. This is another one for symptom management, also funded by Children's Healthcare of Atlanta. And so this one, when it was presented to us, what the issue was, I literally cried. It's horrible. So there are some kids out there who have colorectal issues. And so essentially they use the bathroom and they have no control over it whatsoever. And so it happens, at school in the middle of the day. Like, it's a real problem. And you can imagine what kind of social interaction these kids might have with other kids. Just really horrible. And something like a third of the kids with this condition commit suicide because it's that awful. I mean, horrible. And so what we did is we worked with some teenage kids who have this issue, and the goal was to help them reduce the amount of accidents they have. So we know we can't go to 0 on accidents, but we think we can reduce them if we can manage it properly. And part of managing it properly is just taking an account of when things happen during the day, and that lets you know when you might need to go preemptively and that type of thing. Because this is like an embarrassing issue, we didn't want anything to stand out to anybody else. Like when they're interacting with their peers in high school, they would rather just like click a button really quickly and be done, as opposed to, playing some game or whatever. Like we always think about games and apps for healthcare. This is one, though, that it was much better to do something that was much more discreet, and it can keep the log for you, and you can then better control your symptoms. And so this one and Your App are both out on the App Store for use, so people can actively use this. This is something that I just wanted to bring to your attention. So there's a professor on campus named Wilbur Lamb. He's in the biomedical engineering department, but he's also an inventor. He worked with the student who did the pictures of the nail bed for anemia, because he also has another technology for anemia measuring. He's also the one that did the cell phone app that can look in your ear to take a picture if you have an ear infection. So you may have heard of that one. I think it's called CellScope. Well, he's got another grant called the App Hatchery. And essentially, App Hatchery is to take real-world problems from clinicians, and actually, I don't know that it has to be, yeah, it does have to be healthcare. And they can then build the app. And so if there's anyone out there, one of the main reasons I put this on here is because if there's anyone out there who likes building apps, either Android or Apple, please reach out to me. I would love to put you in touch with him. He is always looking for good programmers for the mobile healthcare space. And so if you are interested, again, please feel free to reach out, and I will hook you up with him so you can learn more about what he has going on. But it's kind of a unique thing, and it was a huge grant that he just was awarded by the NIH. Okay, so I meant to take this out. No, I didn't. Beth, I was thinking of you when I did this one. So they're working on 2 apps right now, and one of them is called Hometown, and essentially it is for people who have been not diagnosed with cancer necessarily, but have the risk factors for cancer. So maybe you've tested and you have the BRCA genes for breast cancer or something like that. What this is here to do is to help you watch for certain things so that you can detect it early if you have cancer. So it's really about helping you manage everything, and then also, letting you know things to watch out for. And then while you're tracking things, it might give you little warnings like this is unusual, or you might want to go see your doctor about this. So I think that that's pretty interesting. Put ICANN in here. So I mentioned when I was introducing myself that I'm the president of something called the International Children's Advisory Network. And this is an organization that really focuses on giving kids a voice in healthcare. And so right now, devices are made, not necessarily talking to the patient who's going to use them or receive the treatment or what it might be. And in clinical research, children haven't historically been as involved. And so what we're trying to do is give that child a voice to say, work with industry and say, I like X, Y, and Z about what you're doing, but this is horrible and that's like a no-go or whatever. Or maybe it's to read a protocol for a clinical trial to give input before the clinical trial starts to say, this doesn't really make sense to a kid. It would be better if you said it like this, or whatever it might be. Anything along those lines, or, I can't come in every Tuesday at 10 for a shot because I'm in school those days, things like that. Both of those are actual things that we've had to tell clinicians before with what they're doing. But one of the things about this is, the reason I bring it up is because we have a Georgia chapter. It is in conjunction with Children's Healthcare of Atlanta. Any child is able to participate, 8 to 18. So if you know kids that might be interested in joining, they're absolutely welcome to. It's free. But our chapter specifically works a lot with Georgia Tech. So we work with the Capstone program in BME for our kids to come in and give feedback to the kids in the BME program who are working on pediatric devices. We've also had them talk at classes and things like that. So I think there's a lot of opportunity there if you wanted to kind of have the voice of the pediatric patient available to you when you're doing your project. I think that's all I had today. So I'm happy to take any kind of questions that you might have. Come on now. Don't be shy.
Thanks, Leanne. This is awesome. I think one of the things that I know we've been working more in is esports.
Yep.
As not just the fan experiences, we're doing that too, but also the physical damage that can occur from sustained engagement with these types of experiences.
Yep.
Are those discussions between iPad and PTC underway? What could we do more of? Is there interest by some of these partners in these kinds of questions?
Yes, so I guarantee that there are interest by some of our partners in these kind of questions for sure. I mean, you could the one that listens to the sound that the knees make. I mean, that's very similar, right? You want to listen to it. We built a sensor to help them figure out when the child will be ready to go back to playing sports. So 100% it's of interest, and I have talked to Shiva about it some. I know that we would like to talk further. In fact, we may even have a meeting being set up. I don't know if he's on today or not. But yeah, I definitely want to talk about that because I think that there is a lot of overlap there with things that we can do, certainly.
Yeah. So I think, one of the aspects of COVID is, of course, even more esports and electronic and online gaming, not to mention our two sons. But yeah, I think this is something we could grow more of.
Yeah, absolutely. I completely agree. And I know iPad works in the space of you know, apps, mobile health, that type of thing too. So there's a lot of that going on. And I think if anyone ever has an idea and says, I think this app might be useful, feel free to reach out to me, and I'm happy to talk you through it or help you find a clinician who can give you information that you might need to make it work, whatever it might be.
One of the things that unfortunately I've had trouble getting traction with in Georgia, so maybe your U.S. networks would be easier, is more on the mental health side of things. It's pretty distributed in Georgia in terms of those capabilities, so there doesn't tend to be kind of a concerted research engagement compared to other areas. But it's also an area that is, of course, of even greater scrutiny during this time. And one of the areas that we would like to grow that more in is actually in the role of AI and monitoring technologies. And not counting all the Black Mirror episodes that are already out there. So if you ever know of folks who are really interested in mental health, privacy, the role of parents, it's a really hard space to negotiate. Yeah, I think that would be something that we could also build out.
I think that would be really interesting, and I know that that's a huge topic area. Kind of relating that a little bit, so like the kids with colorectal issues, that app was really built to help them not have as much anxiety as they do and put them under as much
Yep.
stress as they are. We've also had another one for the Aflac Cancer Center. It's an app that the kid walks through their appointment with, so when they have cancer, they might have 2-3 hour meetings at the doctor's office for different either types of therapy or chemo or whatever it might be, and it helps track how the child is feeling um, during the course of the time while they're at Aflac. And I see me frozen. Can you still hear me?
I can.
Okay, good. Um, but it watches the child. The child interacts with it during their whole 2 hour stay, and it helps identify a clinician to tell somebody if that child is feeling a lot of anxiety or stress in whatever part of it they're in. So I think that that's kind of an interesting thing to do too. I do think that mental health strategies in general is huge, and I think that there's a whole group of clinicians at Children's who are interested in ways to get information about mental health in the rural setting where there is no specialist. So let's say you're a general doctor in the middle of tiny town Georgia. There maybe isn't a mental health specialist there, and maybe they don't know everything about it because that wasn't their specialty area, but it's something you have to get right. There's a whole group and a network around the state of Georgia who would love to be able to access mental health care and references for their patients in these areas where a specialist is not available.
Yeah.
So that's something to think about.
Yeah, definitely. All right. This was me just asking Leanne questions so everybody else could figure out your questions. And then I guess my last thing is, because we've done this so successfully in the past, and I know it came up in the call last week, to create a collaborate workshop or something that tries to bring together. The problem is that these players change so much, especially over at Children's.
Yes, they do.
So if there could be a way of kind of reinvigorating those connections and brainstorming, it'd be fun to do that even online.
Yep. So one of the things that we've been talking about with the new endowment funding that we have is to kind of start doing these half-day sessions again that really bring the clinicians together with the people in relevant research areas on campus to talk to each other about what their needs are, what kind of things they already do, and to then kind of help stimulate that conversation to go after a proposal together. And so we do expect to start those back up this upcoming year in 2021, and hopefully they will all be associated with a seed grant call to really encourage people to truly talk and make a plan of something to go after.
Thank you.
Anyone else besides Beth?
Caroline's got some very thoughtful questions, I can see.
I do. I have loads of questions. Unfortunately, not related to any of this. I'd like to ask Leanne about a certain offense and defense that that particular alma mater is running right now, but I don't really think that that's pertinent to this call.
It's painful. Esports-ish.
Yes.
Sports-ish.
What's that?
I said sports.
It's what?
Sports.
Yeah.
Esports.
It is esport. Yeah.
Mm-hmm.
Exactly. Yeah. It's actually, I think if we get any better, it's not Georgia Tech. It's our alma mater. If we get any better, we're going to suck. But we're not at the suck stage yet. We're aspiring.
So aren't all sports kind of esports right now?
No, some of them still have the the advantages of catching COVID. So there you go.
Yeah.
So one of the things I wanted to see, because I see Lindsay is on here, is Leanne, I don't know how much connection there is between kind of your pediatric network and like the areas where Lindsay works that are more about, Lindsay, I'm going to get this wrong, but DFACS and social services and understanding children that are at risk for abuse in the home, and if there's ways of pulling this information together.
Yeah, we would love to look at that. I will say one thing aside from research, but with ICANN that I talked about, is we are working with, I can't remember which state, but to work, California, to work with possibly their foster care system to give foster care kids a chance to learn about ICANN and become a part of it, especially the kids with some sort of medical condition. And so that I would love to try to figure out how to connect, with anybody in the Atlanta area. I think that would be a really interesting opportunity for some of those kids. But in general, yeah, we're interested in that. Another thing that we're doing right now is, and I don't know why I didn't put a slide in here on it, but y'all know Deborah Lamb probably runs Smart Cities and was just put in charge of the governor's newest innovation center, public-private partnership. And so I've been talking to her about healthcare in that role. I was on the original committee when they had different areas of expertise, all kind of figuring out what pilot projects might want to be. And what I would love to see, and I think Children's Healthcare of Atlanta is on board with this. I have a discussion with their CTO coming up, is to look at ways that Georgia could kind of make a name for itself in the healthcare space, in innovation. And I truly believe that the one way we can really do that is to look at data analytics and kind of the big picture of data analytics, precision healthcare, phenotyping of people to understand what treatments might work better for some than others, and that type of thing. And so I think that that's an opportunity that will continue to develop. I'm excited about that.
Can I follow up on the first part of that, not the precision analytics? And that's interesting to me, but that's not really at least where I work. But so I'm in the process right now of, I think there's a lot of potential for patient level data from CHOA, for example, to study all sorts of issues related to child abuse and neglect. So just as an example, the project that I'm working on right now is looking at COVID and the pandemic's effects on patients that are coming to the hospital for child abuse and neglect related injuries. Mm-hmm. In addition, there are all sorts of opportunities for things like studying the opioid crisis. I happen to know this because I just got a paper published today on opioids and foster care. So I think there's a lot of potential. I will say, though, that I've had quite a bit of difficulty in, many of you on this call have been involved in these emails, but quite a bit of difficulty in actually getting the data from CHOA, the hospital records. So I was under the impression that this was a fairly seamless process because of the enormous amount of collaboration that exists between Georgia Tech and CHOA, but this has turned out to not be true for my experience. Yes. But this is perhaps the naivety of a junior faculty member who's just excited about the collaboration opportunities.
Well, so I'll tell you that the person who was in charge of the IT at Children's left earlier this year for medical reasons, and so they just now appointed somebody new in charge. It was the person they had as the interim. And I think with Jeremy coming on board, one of his main goals is to really make data available to Georgia Tech people to do research projects like this, because it is difficult right now, and Richard can attest to that. But if we want to try again, please, you can reach out to me and Richard, and we can help figure it out. But it has been very painful, but I hope with Jeremy coming on board that it becomes much less painful, because he's ready for it, and he understands the benefits of it and that type of thing. So I think that I hope that that's going to change maybe in the next 6 months.
Leanne, I want to throw out for Lindsay, I wonder through the iSpy network, we've in working with Children's National, Children's Healthcare of Orange County in particular, those two seem to be a little bit more, they appear,
risk-friendly.
They appear, let me make sure we're clear about how I'm saying this. they appear to be less risk averse, I think, than CHOA. And so, Lindsay, if you would be open to maybe another pediatric institution outside of children's, I would love to try CHOA first, just because it's here in the state, and we are a state institution, and we do love children's healthcare of Atlanta. But if we can't, for some reason, move the needle there, Leanne and I've got some pretty strong connections into some other pediatric hospitals around the country, so they may be very open to it, where we may not be able to bust into children's. I just like a backup plan for you.
Yeah, absolutely. And you're right about Children's National. So we're working on a DUA with them right now to use their data from the emergency department for some capstone programs. And so that's underway. We hope that that gets signed sooner rather than later. And that's actually moved fairly quickly, relatively speaking, to how long some of these take. Again, I hope things are going to change with the new CTO at Children's in Atlanta. Also, Dallas Children's, I will throw this out. They are super willing to be a test bed or a guinea pig for just about anything. If you have something that you want to test in the healthcare setting for pediatrics, they are all about it. So Children's Healthcare of Atlanta is a little bit risk averse sometimes. And so we could, like Carolyn said, we could start with one of these other hospitals that is maybe a little less risk averse, and we might be able to do a little bit more with them. So I'm happy to talk to you sometime if we want to make a time to sit down and talk, and we can kind of map out what might be the best course of action for you.
Yeah, that'd be great. Thank you. I will say, sort of piggybacking off of Caroline's comment about, CHOA's right down the street. We also, have the ability, for example, just in this COVID space over the last several months, I've been working with people in DFACS and in CHOA, and we've sort of been working as a big team on this. And so I definitely think that the opportunities for CHOA are just so much more. It's so promising. But the logistical hurdles are very real, and for something that we're trying to move really quickly on, such as like the pandemic, trying to get information out there right away, this has proven to be very difficult.
Yeah, definitely. I think, again, Richard can help if you go to him. Between he and I, we can get to the right people at Children's to kind of take it to them at the highest level about this, and that might help speed things along a little bit. Can't promise, but certainly happy to try. And then are you working? Go ahead, Richard.
I was going to say, yeah, and I know the point that we're stuck in right now is with the DUA, which goes through both legal sides, and they have no matter how many times we do it and use the exact same form, there's usually always all sorts of back and forth. Yeah,
I know now, Lindsay. Yeah. Yes, it's painful. It is not easy. That's very true. I was going to ask you though, are you working with any other hospitals about COVID data, or are you really just looking at the pediatric space?
Really just looking at the pediatric space. So we're studying child abuse and neglect, and the appeal of using CHOA data is that it's the children's hospital in Atlanta. So through all of its systems, if you're going to go to a children's hospital, it's going to be within CHOA system. So they'll be in the data set.
Okay. Okay. Anyone else have a question?
Now that we've given you some good problems to solve. No.
Yeah, I was gonna say, and then the other thing is, and you're doing a good job of it, is just trying to keep saying whose desk is this sitting on, because it'll go sit on one of the legal side's desks for quite a while.
I'm very good at that, but I fear that I'm too good at that I will start to push too many buttons here.
No, I would push every single button almost as often as you can. Truly, I can ping them, Richard can ping them, you can ping them. Yeah, keep pushing those buttons. You're good.
And I would tell you, Lindsay, when it comes to from the even the corporate side, and I mean, you've got Richard and Leanne there, but I don't have a problem pinging them either from the overall relationship side between the institute and whatever hospital it is, because to me, if we're stopping something, we're hurting that overall relationship, and I don't like that. So I don't have a problem picking up the phone and nudging either. So if you keep us in the loop as to where this is going, you don't have to be the only one. You don't have to be the bad guy.
And I will throw out that in the latest conversation I had with the person who's the new CTO, he wants to know where the holdups are to make this run a little bit better and easier. So again, I really hope that he can make a change here to make it just kind of easier all the way around for Georgia Tech to interact with them on data.
Look how optimistic Beth looks on that one.
Please. Yeah.
You're just going to put the straw in the wine bottle, right? Just straight into the wine bottle.
It was easier with the former CTO. It became almost impossible with the last CTO, and I hope that this one, he seems like he's going to be like the first one, so I have hope that it will be good.
You can hope.
Yeah.
All right, Leanne. Well, I'm sorry that we're not in person and can't hang out and swap stories with beverages. No. Caroline, you're in charge of getting everybody together. But it's good to see y'all. And we've got your slides. We've recorded the opening so that we can provide that to the larger community. And then, let's keep working on these projects and more.
Okay. And again, anyone feel free to reach out. I'm happy to talk to you about whatever in the healthcare space.
Awesome. Y'all be good.